More than 9 million U.S. veterans depend on the Department of Veterans Affairs health system for care. Although the VA's well-publicized problems have revolved around capacity and access rather than quality of care, which has been as good as or better than that in the private sector, there's ongoing debate about how to ensure continued improvement in healthcare delivery. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with David Shulkin, former Secretary of Veterans Affairs. Dr. Shulkin has co-authored a perspective article about using competition to ensure high-quality standards for VA medical centers. Dr. Shulkin, under current policy, which veterans who are part of the VA health system can receive care from private sector providers, and for what kinds of conditions?
Well, right now it's still fairly limited. The old rule that was put in by Congress was that you needed to live 40 miles from a primary care physician who worked for the VA or have waited for 30 days for care. Some of the more recent legislation's beginning to open that up with an eye towards allowing more veterans to have choice in where they get their care from the VA or outside the VA. And of course, that's something that as Secretary I pushed very hard for.
So that new program, the VA Choice Program, which was created in 2014, what was the impetus for that, and has it achieved what it was intended to?
Back in April of 2014, the beginning of what many people call the VA wait time crisis that was found in Phoenix and then found to be in many other parts of the country, we were finding veterans waiting for care for often way too long. And unfortunately, probably some veterans were harmed from that wait. And because of that, Congress had made the decision to allow veterans who were waiting for care or live long distances from VAs to go out and get care from private sector providers. That's what's called the Choice Program.
In your article, you talk about using competition as an improvement strategy. So what kind of data exist on the quality of care at VA medical centers now? And are there certain areas where the VA especially needs to pay attention and improve?
Yeah, overall, the VA system is really an important system that's doing very good work in terms of outcomes and quality for veterans. But it's a very large system, and there's significant variation in that quality. And one of the things that the VA system really did not work on for a long time, one of the things that I focused on as Secretary, was to have more consistency in the quality standards. So you're going to find a lot of variation. And my call for greater competition would be to allow veterans to have transparency into the quality of care, and where that quality is falling below the private sector standards, that veterans be given more opportunity to get care wherever they choose, either in the VA or in the private sector.
You point out in your article that VA medical centers operate under a fixed cost model and that they haven't traditionally competed for market share or faced the type of performance standards that exist in the private sector. So what effect has that had on motivation to innovate and improve?
Well, I don't think that it's been helpful. I think what we're seeing in the general healthcare market is a great deal of innovation. And a lot of that innovation happens around the reimbursement model. We're looking at new ways of paying for care that focuses on improving quality and decreasing gaps in care, like bundles in care and value-based payments. And the VA has not participated in any of those payment innovations because Congress has set fixed rates for payment. And what I believe is that the VA needs to be an active participant in all of these innovation models, and that it needs to be allowed to compete both with the private sector, which I believe the VA can compete with the private sector, but it needs all of the tools that the private sector hospitals have as well.
Well, in that regard, you say in your article that the VA's ability to innovate, to introduce and respond to increased competition is going to be predicated on obtaining sufficient resources to modernize its facilities, its technology, its management practices. So what are the prospects for increased funding for the VA?
Well, I think this is really the systemic look at the VA health system that's been long overdue. When people talk about sending people out into the private sector, what people in VA fear is this is really just a code word to dismantle and close the VA system. But if you're going to do this in the right way and what's right for the veterans in the country, you need to allow VA to successfully compete. And that means having the capital to be able to invest in modern state-of-the-art facilities, in being able to have the tools to be able to hire the best healthcare professionals, and being able to participate in some of the innovations that are happening in both payment and technology. But if you allow the VA to be successful in that competition, I have a strong level of confidence that the VA health system will perform as well, if not better, than many private sector hospitals.
You talk in your article about a recently formalized approach that the VA has adopted for dealing with low-performing VA hospitals. Can you give an example of the kind of performance issues that might occur at a medical center and what the response under this new system would look like?
Sure. I do believe that in the current VA system, there's not enough of a impact to a hospital if it's doing really well from a quality perspective or doing poorly from a quality perspective. And so what we began to do was to start focusing on those hospitals that were not performing well from a quality perspective. And we formed a management structure that focused specifically on them. We looked at predictive analytics to identify where those problems are, and then developed an accountability grid to determine how we're going to see improvements and consequences if improvements didn't occur, such as a change in management, and also opening up that hospital so that veterans didn't feel like they were stuck in the system that wasn't performing well. And so my call for greater competition is really making sure that hospitals in the VA that are performing well get to grow and get more resources and get to prosper, and hospitals that are not performing well also have consequences. And that's really the system that we see in the private sector.
Finally, what do you see as the future for veterans' healthcare? Do you think privatization of the VA is going to stay on the table?
Well, when people talk about privatization, they tend to simplify it. In my mind, this isn't a matter of that the VA system should be privatized. I just think that would be a bad idea. That would be bad for veterans because the needs of veterans are so different in many cases than what you find in the private sector that we'd really be going back on our commitment to our veterans and the responsibility that we as a nation have to those who have served. But that doesn't mean that we shouldn't be looking to work closer with the private sector and instill what we see working in the private sector into the VA system. And so my ultimate vision for the VA, which would be a very strong VA, would be one that is more of an integrated system where veterans who have specific needs can seek care in the VA system, but when they can get that care easier or better in the private sector, they also have access to that care. So it would be a seamless system between both the private sector and the VA system.
Thank you, Dr. Shulkin.